What is transsphenoidal surgery for skull-base meningiomas? Imagine reaching a tumor deep inside the skull without opening the head. That's what transsphenoidal surgery aims to do. It's a minimally invasive way to remove tumors at the base of the skull, especially meningiomas. These tumors grow from the membranes covering the brain and spinal cord, called meninges. When they develop near the front of the skull, close to the pituitary gland or the sphenoid sinus, this approach can be very effective. The surgery involves passing through the nose and the sphenoid sinus, which is a hollow space behind the nose and eyes. Surgeons use a small camera called an endoscope, along with a microscope, to see inside clearly. This allows them to carefully remove or reduce the tumor without needing to cut open the skull. Because the approach avoids large incisions and brain retraction, patients often experience less pain, shorter hospital stays, and quicker recoveries. This technique is especially useful for tumors near the pituitary gland or the front part of the skull base. The size and location of the tumor are important factors in deciding if this surgery is suitable. Surgeons evaluate whether they can safely access and remove the tumor without damaging nearby nerves or blood vessels. Sometimes, they may only remove part of the tumor if it is tightly attached to critical structures to avoid complications. During the operation, the surgeon carefully extracts the tumor through the nasal cavity and sphenoid sinus. The goal is to relieving symptoms like vision problems, headaches, or hormonal imbalances caused by pressure from the tumor. While the aim is to remove the entire tumor, sometimes only part of it can be safely taken out. This depends on how the tumor is attached and its proximity to vital nerves and blood vessels. Risks of this surgery include cerebrospinal fluid leaks, which happen when fluid escapes from the brain into the nose, hormonal imbalances if the pituitary gland is affected, and temporary conditions like diabetes insipidus. There is also a small chance that the tumor may grow back, requiring further treatment. However, compared to traditional open surgery, transsphenoidal procedures usually have fewer complications and allow for faster recovery. In summary, transsphenoidal surgery is a specialized, less invasive way to treat meningiomas at the base of the skull. It provides a way to remove or reduce tumors through the nose, avoiding large cuts or brain surgery. This approach helps preserve neurological function and speeds up recovery, making it a valuable option for many patients. If you or someone you know is considering this surgery, it's important to discuss with a qualified neurosurgeon to understand if it's the right choice based on the tumor's size, location, and overall health. Always seek personalized medical advice from healthcare professionals for the best outcomes.